like he's got a boil on the bottom. This is like the opening of a Carry On sketch. But I didn't realise they can be, A, excessively painful and have to be operated on. Is that the case?
Yeah, this is probably not a nice image at lunchtime, but
No.
if you're not having your sausage roll or sandwich, the reason they're so painful is because they haven't got very much room to expand. So they fill up the tissues, the subcutaneous tissues, and they're full of toxins. And as they stretch things, that's quite a sensitive area, absolutely. And that's one of the really, really kind things to do with someone. That's why if you go to your GP with a boil, what they'll do is try and pop it and burst it for you. Because as soon as the pressure goes, you feel so much better. Then you have your antibiotics, etc.
But it's straight out of the Middle Ages, really. Oh, I've got boils.
Yeah, no, they used to be called furuncles and carbuncles, and they're such great names.
Oh, the quinsy, and what was the other thing that used to pop around the neck? The things, is that quinsy?
Yeah, the quinsy is a thing. It's a peritonsillar abscess right at the back of your mouth, so you can't really swallow. And the name of a pathologist on the American TV series, a bit.
You are a fascinating man. I'd love to take you on holiday and perhaps lecture my son when kids, and actually friends of mine have just come back from Greece, when kids are, getting drunk, party all night, then sleep on the beach throughout the day and go lobster red. Surely there is information and education out there about skin melanoma, especially when you're going on holiday.
Yeah, no, there's absolutely masses. We know that melanoma is doubling every 10 years, and it's now a massive cause because it's a not only is it containable if it's treated early, but it's potentially curable. The problem that we see increasingly is that its moles are either ignored or they surface too late. And certainly the damage that you get as a child is really, really, really important. It used to be said that you have more sun exposure by the age of 18 than you do for the rest of your life. But that was different. That was about 20 years ago, when all we did was play out in the sun when we were little on our bikes, whatever we did. Whereas now with foreign travel and the whole way society has altered, and of course use of sunbeds, things like that, that phrase, that kind of assumption that you have all your sun exposure as a child and before your teenage years is no longer correct.
I've got a lovely question here which says, what's the difference between plastic surgery and plastic surgery? I suppose they're saying, what do you do? Do you do cosmetic surgery? Do you do reconstruction of stuff?
I do. I do both. A lot of the procedures in cosmetic surgery have derived from reconstruction. The best definition I know is that plastic surgery, it comes from a Greek word plastikos, which means to form or mould, and it's surgery designed to restore form and function and to improve well-being. So some parts of it will be to rebuild and restore abnormal tissues or disease, and another part of it is to deal with normal tissues to either enhance or change or alter them, and that can make a huge difference to the way someone feels about themselves.
Well, Sandra texted me a couple of days ago because and she is a friend of mine. She said, can people still breastfeed if you have breast implants?
Yes, you can. Virtually everybody can breastfeed when you have a breast implant, because the implant is either going underneath the muscle, which will make no difference at all. That's the big pectoralis muscle, your big chest muscle. Or you can put it in front of the muscle, and either way, the milk ducts will still work. They'll still produce milk, and you can still lactate.
Okay, lovely. You're happy to take some calls in the last 20 minutes?
Yeah, I don't mind.
Lovely.
People can ask me what they like.
Superb. Vic is in the studio, 0845 301 1034. Do you have lumps and bumps and moles? I think nearly every one of us has at least a few moles on their bodies. Statistically, these can vary in number from between 10 and 50, it says in front of me. I've got things there. What would you say that is? Hello, my faith. 1:43, the interactive lunch. We've changed the subject totally and talking about lumps and bumps on the skin. Skin tags. Vikram Devaraj is in our studio in Exeter, the Royal Devon and Exeter Hospital. How long have you been at the RD&E?
Nearly 17 years.
Settling in then?
Yeah, I'm just getting used to being in Devon, as a foreigner from foreign parts, just working my way around.
Well, I've got to ask, skin tags. Do you know, I noticed, I like to share with the listener, skin tags, I get them occasionally. Tiny little, mauve coloured, I'm colourblind, grey, like tiny little lesions that hang there. What are they?
Yeah, the little fleshy things called papillomas, and they like to grow, they like to germinate, they like to flourish in moist regions. So if you are have a degree of well, this is such a lunchtime topic. If you have areas like that where they want to grow, they do, and they're completely harmless. They don't mean anything at all Sometimes you can treat these and you can either laser them off or burn them off or use liquid nitrogen. Sometimes you can even cut them out if they're quite thick at the base, and it's really straightforward.
Good grief. Liquid nitrogen?
Yeah, liquid nitrogen. You know, it bubbles out. You see these in the Frankenstein films where the guy's in his laboratory with a test tube and all this stuff is bubbling out. It's called cryotherapy.
I've never met you face to face. I got a very bad impression of you now. I can just see you. Helen in Plymouth has rung. She doesn't want to go on air. She's had surgery for malignant melanoma 10 years ago on her skin, with skin grafted to cover it from her inner arms. Will the scars from the donor sites fade anymore? She can't. Can she do anything to reduce their appearance?
That's a good question, and it really depends on what they look like. It's very unlikely that the appearance of them will change on their own, because usually scars settle after the first couple of years. If they're very red and angry, sometimes that can be covered with some cosmetic camouflage, and it'd be worth looking up a good cosmetic camouflage practitioner. And if she approaches her GP or her local plastic surgery department, they should be able to help her. So that's a way of disguising the appearance of it. And sometimes they can be done with waterproof colours as well, pigments. So you can go in the bath or swim in the sea, etc. The next thing to do, if they're really, really red and itchy, is that you can reduce sometimes the itchiness with an injection of a steroid preparation, which very gently allows the scar, if it's thick and lumpy, to settle down. You can use silicone gel treatment as well on these. Occasionally, you can use a laser. It's called a pulsed dye laser, and that can be used to reduce the red component. What's important is if she presses it herself and it blanches, so when she lets go, there's a gap, and then you should get the blood coming back. That suggests that it might be what we call hyperemic. There's more blood than necessary, and that might be treatable with a laser therapy.
Do we rely too much on hydrocortisone and all these creams that people are constantly smearing on themselves?
Yeah, no, this is a different form. This is actually an injectable thing. And no, I don't. I think there are certain inflammatory conditions that respond really well. And remember, steroids are a natural product. Our adrenal glands are making them all the time.
Right.
And if we didn't have them, we'd just all be floppy like jellies.
Right. I love this text. I've got to read this out. What a great man your doctor is. He worked on me 6 years ago. No problem since. Very funny man. Where's the tie with the red brain on it? Is that you? See, you can't go out without being recognised now.
I don't know if I've got a tie with a red brain.
Have you got a red tie with a brain on it?
If I have, I'm going to hide it somewhere.
You see, you come on. You're now an international star on BBC Radio Devon. You'll be mobbed in the streets.
We have to be bare below the elbows, so we can't use ties. There's a study that they did at the College of Surgeons.
Yes.
And they cultured the ties from the consultants and doctors looking after patients, and I think they grew something like 50 organisms from the tie, all different. Because imagine every time you lean over someone and you examine them, the tie is trailing on their skin, or worst into a small wound or something like that. And this was the part of the reason that when they actually got the tie and they just put it straight onto an agar plate, they got so many different organisms. Some were commensal, so they're natural organisms. Other were potential pathogens, so ones that could cause harm. And so most clinicians, if they're, well, it's part of trust policy now that you stay bare below the elbow.
I must admit, I did have dinner years ago with a consultant surgeon, and he'd actually been in the theatre. I didn't have the heart to tell him all the way through dinner there was blood spatter down his shirt because he'd rushed in late for dinner. I mean, it is an unfortunate side effect. Fitz, my daughter had a blood poisoning disease which ate her flesh on her legs down to the bone, leaving scars and very thin skin. Is there anything we can do, as she is so frightened of knocking them? She's only 21 years old. Kathy, what, that necrotizing fasciitis, is it? Would that be?
Yeah, that's exactly what it is. It very much sounds like that. Yeah, absolutely. It's something, if she's a local person, it'd be worth her popping along to see, I think, her GP, and then thinking about having a referral, because there are different ways of incorporating soft tissue to actually reinforce what she's got. It might mean moving skin around. It might mean bringing it in from another place and using microsurgery. But absolutely, why not have a look and seek advice?
But these flesh-eating devices are normally associated with, with Africa. Wasn't that the necrotizing fasciitis? Not in this country. Can you contract it in this country?
Yeah, of course you can. And it's something we see not infrequently in Devon. We have a local expert in Devon on necrotizing fasciitis called Dr. Marina Morgan. And it's thought to be a mixture of organisms that involve themselves in this. And one of them is the streptococcus. And absolutely, it's bad news. And it's something that we're really vigilant about in the area.
Amazing. Mary in Torquay wants to know the best treatment or magic cure for psoriasis. Sadly, she has it all over, something which affected several friends of mine as well. Is there a cure for psoriasis?
I don't think there's a cure, and I'm probably not the best person to ask. It's really a dermatological thing, but it's, again, if you go back to your GP and get them to talk to you or refer you to one of the skin specialists, psoriasis is a variable spectrum of an inflammatory condition. And as you say, the symptoms are very debilitating. And again, the mainstays of treatment are to control the inflammation, to try and switch off the process with steroids, to consider a PUVA, which is a kind of ultraviolet light treatment, which she may or may not have had already, to basically slow down the process where your body is making more skin cells that you need. And I have to confess, because it's something I don't look after, I'm not an expert on that, but by all means, there's an excellent dermatology service in the region. It would be worth seeking advice.
Consultant plastic surgeon Vikram Devaraj is in the studio at the moment. Port wine stains, which I assume is a birthmark. The redness. Again, a friend of mine's got one on most of her cheek. Can those be removed by surgery?
Yeah, you can't really remove them because it depends how big they are and how deep they go. Sometimes the very, very vascular bits are very dark nodules that almost look like tiny black currants.
Yep.
Or can be cut out, absolutely. But the mainstay of treatment, again, is a mixture of camouflage and or different types of lasers, which will... The thing about the way a laser works is, as you know, it's a light emitted at a certain frequency, and the red component in the hemoglobin, which is the blood pigment, absorbs the light, and in doing so it changes the character of the pigment and it reduces the intensity of it. So absolutely, you can reduce the intensity hugely by a variety of laser treatments, and any specific big lumpy blackcurrant areas you can cut out.
Is sunlight, can that affect birthmarks like that? Can they aggravate them?
It tends not to aggravate them, but if they're going to ulcerate or bleed and they get damaged, or the skin's really thin over the top, yeah, I think it can aggravate them. The problem with port wine stains is they can be really extensive, they can be very deep, they can be of a very large area, and so treatment is often sequential. It's ongoing through a long time in the person's life, and of course sometimes you can't eliminate all of the areas, but you can make them look less worse.
Oh, sure. Well, listen, look, we have run out of time. Thank you so much indeed for also bearing with us today on the situation. If people want to come and see you, I assume you have to go via a doctor first if you have any sort of skin complaint.
Yeah, you can go through your GP. Sometimes if you want to access a service directly and it's something that you don't think the NHS will fund, you can do that you can just phone the Exeter Nuffield and they've got a helpline and just seek advice. But otherwise, if it's something you feel that needs to go through your GP, by all means go and talk to them and they'll guide you in the right way.
Okay.
But thank you. Thanks very much for asking me to come on. It's been a pleasure.
No, it's superb. They say there are still texts coming in, your big fan club, and they are still insisting that you have a small brain on one of your ties.
I've just got a small brain and I don't have any ties, so they're almost right.
Still available for pantomime.
Absolutely.
Thank you very much indeed.
Take
Cheers.
care.
Bye-bye.